Hi you guys, welcome back to The Dent Life. My name is Komal, and in this video I'm going to be talking you guys through my clinic diary or my patient diary and how I basically organise it. So I started my clinic diary in first year. That's when I started clinic, and I was a little baby that was really scared of patients and just scared of the whole idea of clinic. Clinic can be very daunting when you first start. Even the idea of wiping down can be really daunting, or putting your PPE on can be just scary. But yeah, one way to make it easier is by actually having a clinic diary and just by keeping organized. So that means writing a list of your patients, the appointments they have, and what procedures you're going to be carrying out on them. I like to check my clinic diary every night before clinic, and when I checked it, I either made notes about the procedure I'm going to be carrying out the next day. So for example, if I'm doing a root canal, then I need to make notes on what steps it takes to do a root canal, or I'll make notes on what kind of instruments I need tomorrow so that I don't waste time on clinic trying to prepare for my treatment. I've already got it all laid out before the patient even comes into the clinic. So I actually have two diaries for clinic. They both serve their purpose at some point through my university journey. So without further ado, let's have a look at them. So this is diary number 1. It is where I wrote about most of my patients and my targets. It starts with a treatment planning note that I can refer to when I make my treatment plans for my patients. It includes what I should be diagnosing, how I should be making a prognosis, what my treatment planning should include, and then a reminder to get consent from my patient. So it's not super helpful now that I look back at it, but at the time it made my life a little bit easier. So then I have a list of my assessments so I can tick them off when I complete them. I did actually complete everything, but I stopped using this book in 5th year, hence the lack of ticks. Then I have a list of my targets and a tally to see my progress. It was super helpful for me to have a constant visual account of what else I need to do to pass. In the UK, you have to do a certain number of each procedure in order to qualify, but even if your dental school doesn't have targets, it's still nice to set goals and meet them. Then these folded pages are my previous patients starting from 3rd year on to 4th year and so on. I folded the pages once my patient's treatment was complete. Now in 5th year I wanted to go into a bit more detail about my patients, so I moved this concept into my diary. This is a 2019 to 2020 day to page Matilda Myers diary. Like I said in my previous video, I really don't like the pattern, but I love the layout inside. So again, here I have my assessments and target tallies, then my patient list, the type of treatment they require, if I can carry out any of my assessments or targets on them, if I can use them as an exit case, how many appointments I think they need, have I planned their treatment. Then I have an exit case guide to refer to, reminding me to get a full history, pre-op and post-op photos, clear diagnosis, treatment aims, then a list of procedures and how long I should give myself to do them on clinic, then some reminders on how to do really well in my exit case, so justify every treatment, reflect on things, show skills such as team working. Okay, so this is why I transferred my patient pages into this diary. They're very detailed. I have this sheet that I used when I had my first appointment with each patient. If you guys want a downloadable version, then let me know. So it goes through everything: consent, medical history, age, occupation, complaints, history of complaints, previous dental history, charting, BPE, oral hygiene, diet, prompts to take photographs and radiographs, differential diagnosis, further special tests, prognosis of treatment, final diagnosis, and then the treatment plan. Phew, okay, that was a lot. So this was then used throughout the year to help me organise outside of clinic, as I don't have access to patient notes at home. Then you can see my treatment plan that I ticked off as I completed each treatment. Here I would write some notes and potential questions I had about the case that I could ask my supervisors. Then here I wrote a list of appointments I have booked, but I quickly realised that appointments change due to either patient or me rescheduling, so I thought these sticky labels were a better idea so the appointment date isn't set in stone in my diary, hence doesn't mess up how it looks and doesn't have scribbles all over it. Then I got so busy that I kind of stopped doing that. Anyway, as you can see, I did this for all my patients and it really helped me keep on top of my treatments, targets, and just made my final year so much easier. Then at the back, I've got a little list. It may be bordering on kind of an obsession, but basically I have a list of all my clinic dates and what I have planned for them. Again, in hindsight, I'd probably use sticky labels and at least a pencil, just so that things don't mess up, as appointments do change a lot. So yeah, excuse my handwriting and apologies that this isn't aesthetic, but this did really help me through clinic. So that was a flip through of my clinic diaries at university. I hope you found it helpful. Let me know if you did, let me know if you didn't, let me know what else you want to see from me, and thank you for watching.